Hey, what's up guys? Devin here with Backcountry Exposure. Today we're going to talk about my backpacking first aid kit from the perspective of a wilderness first responder. I recently recertified my wilderness first responder certification, and I want to share with you guys what I carry on the trail that might be different from what a lot of people carry on the trail. So I've got a roll of athletic tape here, which is going to come in handy for a lot of different reasons. It's going to be used for blisters, for wrapping and taping ankles that are sore or have had some kind of injury on them. I have wrapped a lot of ankles in my time as an instructor teaching backpacking. Different forms of medicines. I've got aspirin, I've got Tylenol, ibuprofen here as well. I've got an anti-diarrheal. I'm always going to carry different types of antiseptic wipes, alcohol wipes, things to be able to clean an area before I bandage it. And really important, I normally carry more gloves than this, but I need to replenish the gloves in my kit actually. But nitrile gloves are always a really important thing to have in your first aid kit, because if I'm working on other people, I don't want to get their blood and such on me. I've got a wound management kit here that contains steri strips, and I've got, they're wound closure strips, steri strips, and then I've got semi-permeable transparent dressings. So these allow me to cover and help prevent infection after I use a syringe to be able to irrigate any kind of laceration or a cut really well, to be able to manage that effectively in the field so that I don't have to evacuate myself or somebody else because I can't manage the ability to keep an infection from starting on a laceration. And I'll use this little vial of benzoin tincture to be able to basically create a more sticky base for everything to stay put for a longer period of time. This stuff is awesome, and it's really great for blister care as well, which, speaking of blister care, I've got a whole pretty robust blister kit system here. KT tape, and in fact KT tape has learned that works really well for blister management, and so they actually came out with these blister type of prevention little strips that you can wrap around your ankle into hot spots to help you prevent blisters from happening. But the great thing about KT tape is the adhesive on it is better than athletic tape, and it's stretchy, so you've got the ability to pull it and wrap it around a blister, and it's going to hold on to that piece of skin a lot better than a piece of tape, and it doesn't roll the way that a piece of athletic tape does. So I've got several strips of KT tape here, and this came in handy actually on a trip that I did last year with some of the Ohio boys. I ended up needing to use some KT tape to help support a knee of somebody that was out with us, and it came in very handy in that regard. And then little pieces of moleskin, and then I've got these moist burn pads, which allows you to basically cut out a piece and place it inside the donut of your moleskin that you cut to go around your blister. So you cut your donut, you place that around the blister, then you place this on top of it. This is going to help keep it moist and cool it so that it doesn't continue to burn, because a blister is a friction burn, and so that's what this is used for. And then pre-cut type of moleskin from Adventure Medical Kits. One of the things that I do carry in my first aid kit, just because a small tangent, is a patch kit for both my sleeping pad and for my jackets. So these are tenacious tape patches and tear aid that allow me to use that on equipment as necessary. Gauze pads, I don't carry a lot of band-aids, I just carry enough to be able to manage, enough to get out, because if I'm going for a long period of time, yes, I'll probably carry more band-aids than this, but these band-aids, in addition to the wound closure strips, is going to be plenty for what I need when I go out. So we talked about the irrigation syringe. This is something that I don't see a lot of people carry, but it's super important, and it's worth the weight and the size, because anytime I get any kind of laceration, I'm gonna be around knives and things that could cut me, axes, hatchets, and even pulling stakes out of the ground. I've cut myself, and an irrigation syringe allows for higher pressure water to really irrigate cut or laceration really well to be able to prevent infection. I've got a pair of tweezers, being able to manage ticks as well as splinters, that kind of thing. Then I got safety pins. Safety pins are great for blister management as well as other types of things. And then I've got a pair of trauma shears, which are going to come in handy in a lot of different aspects, but more or less to cut the blister management type of stuff, as well as if I do find myself in a real scenario where I have to perform any kind of thing on somebody and I may have to cut somebody's clothes off, then that is available for me to do that in the field. One of the things that's important for me to carry is this wilderness medicine field guide. It's impossible for me to remember every little aspect of all of the things that I have learned as a wilderness first responder. And so this little field guide allows me, once I have managed the life threats of somebody, if they take a tumble or they've got some kind of medical scenario, then once I've managed those in the patient assessment, then I can open this up and I can start reminding myself of, how do I treat this patient? How do I take care of them properly, give them the right care? And so this is a great way for me to make sure that I'm providing the right care for the people that I happen to be working with, as well as myself. Something else that I carry, because I do also carry a satellite device, is a soap note. So there you go, guys. That is my first aid kit from the perspective of a wilderness first responder, a woofer. And yeah, it's a lot of things than probably what a lot of people carry in the backcountry, but it gives me the confidence and the ability to be able to provide the proper patient care and treatment to anybody that I might come across, whether it's myself, in a group, my friends, or some random stranger on the trail that may need help. So thanks for watching, guys. Subscribe to the channel if you're not. Have an awesome day. We'll catch you on the next video.